good to have you with us in this edition of the Urban Debate at 9 p.m. Our focus continues with another important aspect of COVID, the emerging threat called the Delta variant of COVID virus, which was first detected in our country. Now, why am I talking about this again? We've had so many conversations about this variant because there are more and more reports and studies emerging about how this could be a big challenge. In fact, there's a study conducted by the SARS-CoV-2 Consortium on Genomics and NCDC, where genome sequencing and analysis of circulating COVID viruses was done. Now, this study reveals that the Delta variant was the primary cause behind India's second wave, and that the Delta variant is 50% more transmissible than the Alpha variant. The Alpha variant is actually the one that was detected in UK. Remember how that became a big deal because of how deadly it was. Now, the Delta variant isn't deadly like the Alpha variant, but it spreads faster in an easier manner, which is why it has now become the biggest variant of concern, not just in our country anymore, it's now spread across the world. So it's 50% more transmissible than the Alpha variant. It's prominently detected even in infections post-COVID. So in the study that was conducted in those people who got COVID even after vaccination, this was the predominant variant that emerged, which is why it's extremely important to have this conversation. Now, in our country, in Delhi, in Andhra Pradesh, in Gujarat, Maharashtra and Odisha, this is the dominant one now. And in countries like UK, it has become a big concern. They are re-looking at their unlocking policies and strategies, dangers to children, and their vaccination policy and the vaccines that are being used, with everything now being about this Delta variant. So let's try and understand a little bit more about this variant, how we can't let our guard down, and what of our policies will probably need to change going forward. Dr. RAKESH MISHRA, former director, CCMB Hyderabad, joins us this evening. Professor Gautam Menon, he's a professor in the Department of Physics and Biology at Ashoka University, and Dr. Polly Roy, professor and chair of virology at the London School of Hygiene and Tropical Medicine, the London University, joins us this evening as well. Dr. RAKESH MISHRA, I want to come to you first. We've had conversations about it, but every time, obviously, by then, more genome sequencing has been done, more studies have come from across the world. To just break it down for our viewers to understand just how predominant or dominant has this variant become in our country?
So, the most recent data suggests that this is going to be the variant which we will see in coming weeks. It has practically replaced Alpha, which was, for example, at some time in Punjab particularly, and to a large extent in Delhi, Alpha was very prominent, 80%, 90%. Now it looks like it's mostly replaced by Delta. And rest of the country, Delta is like, for example, in southern part, in Telangana, Andhra Pradesh, is probably close to 90%. So, which means this is more infectious, that establishes that given equal conditions, this will be more successful in infecting people. So, it's going to replace the other existing variants. And at least for coming few weeks, it's going to be this way. Maybe eventually some other variants will come. But for the moment, this is going to be the major variant which is going to replace all existing ones because it's much more infectious than even Alpha, what we have seen earlier.
Yes, and not just in our country, this has now become a variant of concern and everybody's scrutiny in many other parts of the world as well. Dr. Polly Roy, good evening to you. We understand even in United Kingdom, more and more cases of the Delta variant are now popping up. It's become a conversation point, even from a policy point of view. Can you share some insights on the Delta variant and how it is that it's really reached across the world now?
Well, reaching across the world is quite easy. As you know, the world is very small these days. Is people travel, they take the virus with them. That's what it is and nothing else. But this variant, virus is continuously changing when they are inside the body, and more people get infected, more they're making the mutations inside the body. And this particular mutation has several mutations, and none of the site of the mutation, which is called amino acid residue in the receptor binding of the human receptor binding protein, RBD site motif, if they change something drastic, either they will survive, the virus will survive, or virus will die, whatever. They take the chance, they make the error. So this one, they change this to one particular one, one type of shape like leucine to arginine is very, very drastic change. And that make probably better interaction with the cell to get inside. So then transmissibility become higher that way. But you cannot say that they're much, much more transmissible than the others. That's not true. If the virus is circulating there at that time, because you're getting one to another, they will take the advantages of that. That doesn't mean that becomes superior virus. No, that doesn't mean that way. However, this one seems to be transmitting a little better than others because it binds the receptor change, binding site is changed, and then it's going inside quickly. And then because it's spreading one to another, it's even making more mutation. There are several mutations in this particular virus, which are not only receptor binding site, beyond that, which is D614G, is another drastic change. So several drastic change happen in this one, but those changes are seen in the previous virus variant as well, including the one UK variant, first one, alpha one. So it is not so unusual for a virus to change, but more importantly, if the virus circulating more in between few people, then it become more transmissible because they are mingling with other people. So you have to make this very clear that people have to still be very careful not to go in a big gathering, whichever virus they will get in. But every virus will mutate inside the body.
Right.
More they replicate, more they will mutate. That doesn't mean they're causing more disease. No, not severe disease. They're only disease-wise, they are also vaccine-wise. After first dose, they only 17% reduced. That's just England just published. But after second dose, we're still getting protection for the old vaccine that we have in year one, like Covishield, AstraZeneca's vaccine, or Pfizer vaccine, protecting fine, no problem with that. Because it is not only one area that makes the difficult of the neutralization of the virus. It may facilitate the transmission better, but doesn't mean their vaccine will not work anymore.
Okay.
So there's no reason to be worried about that so much.
Okay, no reason yet to be worried that the vaccines won't work anymore. But information keeps, newer information keeps on coming out. For example, I think the Lancet Journal has now published a study which says that the Pfizer vaccine is less effective against the Delta virus. And maybe they will have to relook at the gap between the doses that may have to be reduced. So those kind of changes perhaps will need to take place as we study more and understand more.
But you have to understand more. A lot of this work is not in an actual scenario on the vaccine itself. They're looking into the neutralizing antibody in vitro.
Right.
That will work differently than the actual vaccine in the person.
Okay.
So still you have to believe that this spike protein that making the different antibodies is not only one position, many other positions are important, like N-terminus end also making. And then you have right beyond our receptor binding called SD1, SD2 regions, some changes happen there also. So it will have some effect for the old vaccine, but doesn't mean It is more severe. After 2 doses, you have enough antibody level so that you'll be protected. But as long as you have only few people vaccinated, not all, it will transmit and
Yes.
it will change more.
Which of course, for India, Professor Gautam Menon, will be a key factor because we are moving extremely slowly as of now when it comes to our vaccination, and we have a gigantic population. So it's also a much bigger task than any other country. How do we see this policy-wise, and would we say that we need to be even more careful when we begin to unlock because we haven't vaccinated more people and this virus spreads much, much faster?
Yes, that's certainly true. The only real long-term solution to COVID-19 is to vaccinate as many people as possible and as fast as possible. Right now, the constraints are constraints of supply. Hopefully, they will get better within another few weeks, within, let's say, by about early August or so from all that we learn. If we can at least get all of those above 45, all of those above 60, those with pre-existing conditions, and also those disabled and elderly, very elderly, then we would have made some amount of progress towards at least reducing the mortality fallout of this more infectious strain of the virus.
In fact, because you raised that point, let me start off with you on the mortality linked to the Delta variant. You know, initially we were told that it's not as deadly, it just spreads faster. But there are now reports coming from a few of the other countries who are doing studies on a wider scale that suggest that it does increase your risk of hospitalization, and it's much higher, you know, with the Delta variant than some of the other variants. So would we still say that we need to study a lot more before we can say that this is less deadlier than others?
There's still not, conclusive evidence for that. This is something that has been raised recently. And also we must remember that already many people in India have been infected once, if not, either in the previous wave or in the current wave. What changes that might make on subsequent reinfections? Are subsequent reinfections likely to be milder because you've had an earlier infection? That also needs to be taken into account. So the situation in India may be different from the situation in the other countries where you simply have much less seroprevalence.
Would you like to comment on this as well, of what the studies so far show and how we should interpret it?
Yeah, so there is no clear evidence, and most likely it's not true that it is more virulent or causes more death. And also, the Lancet report you mentioned, in fact, says that the vaccine, Pfizer vaccine, is effective against it. 3% of the cases did not respond, the rest responded. So that is a small change. And please remember that the tests that are being done, they are something we call it in vitro neutralization assay, and immunity is much more than that. There's cellular immunity that gives protection. So far, I think we can be confident that the vaccines are effective against, and we can use that opportunity, because that's an extraordinary opportunity we have against this pandemic, which was actually a few months back not expected. Such a good vaccines will be available. If we can vaccinate large number of people quickly, we can actually get out of this pandemic with less damage. For the moment, this, other than that, this is very, very infectious, and therefore it reduces the crowd, increases the crowd in the hospitals, and that leads to all kinds of complications. There is nothing else to worry about it. And as you have seen, lockdown has drastically reduced the number of infections, which means human behavior is a very strong component, as Professor Rai mentioned, in this pandemic. So if we can be self-disciplined, we can get the benefits of lockdown without the lockdown. And maybe that is somehow we have, because lockdown also for long period of time is very, very is very painful, particularly for economically less advantageous part of the population. So we use the vaccine, keep testing and isolating people, and have self-discipline of not clustering and wearing the mask. We can manage. Variant has not posed any major threat, except that is more infectious.
So okay, you're right, and there is a difference in the way these studies were conducted and practically the impact of the vaccines that we may see. But going forward, as we continue to study the impact more, if it does seem that these vaccines are not able to give that extent of protection for the Delta variant regions. What does it mean? Can we fix that with another booster dose of the same vaccine? Does that help?
Uh, those are the things that we can say with confidence only when data is generated. Maybe same vaccine or another booster of a third vaccine or second vaccine, vaccine interchangeability. A lot of things are happening. See, generally we talk about vaccine with confidence after several years of trial. Have done we have done very few months of trial, and also remember these vaccines are emergency approval. So we are
Yes.
actually learning a lot that how these. I think in coming few months we will understand much more, and I'm sure we will be more confident and more precise about what is the gap, what is the duration, which vaccine, if interchangeability is good, what kind of thing that's going to be. So all that will emerge. Um, but we require data for that. At the moment, it's just a speculation, pure speculation, I will say.
Okay, Dr. Polyroy, if I can come to you on another aspect, again, basis all the studies that are being done in the genome sequencing, is there any evidence to suggest that specific age groups, and especially maybe the children, could be more vulnerable to this variant?
Well, I think that not the children, but older people who are a little bit more immunocompromised, or they don't have they're more vulnerable health-wise, they may get that infection. But again, I will tell you that again, even after first dose vaccine, they will be less vulnerable or more resistant to this virus, even though they will get some infection but may not get very bad disease. Vaccine is the key. And if you don't have the vaccine, we have to protect the way that we already, my other members of the panel discuss, that you have to have in isolations and or make protection, proper mask necessary. But children are not the super spreader, that's for sure. That's what we've seen in England. More will be the healthy people who are infected but asymptomatic. That is the major problem. It's not everybody is going to get the symptom, even with this variant. So it's not that some of the young teenager may get infection, but they may not still show any symptom. Those are the you have to worry about, because they are the super spreader will be. So problem is that if you don't have a lot of vaccine available, then we have to take another way to control this virus, as that we should not transmit one to another. So it's just to take the protection that way. But I do not believe that children should be in the front line to get vaccine immediately. It's the older people who are and can get the disease. They should have this vaccine, any vaccine they can find. And changing vaccine is not that difficult these days anymore. Even if you have mutation, you can make it very quickly. Particularly you have RNA or DNA vaccines that like Pfizer vaccine, Moderna vaccine, you can make very quickly, or even these Covishield vaccines, AstraZeneca, they're already making the variant. It's not difficult at all. But how many times you're going to change? Because the virus will change inside the body. So get rid of that virus fast, as much as possible, so they don't have the opportunity to change. So more people get infected, more they're going to change. But I still believe strongly that whatever we have now, all the variants, we can still get protection. The current vaccines available, all these vaccines will help. Even for you, the Sputnik vaccine is now there. It'll be very good for India to be vaccinated with that. But they are over 90% protective, better than Covishield. So I think that we have to think about how the better way we can control, instead of getting very much excited about variant. Because variant they will change. It's not to get so much excited. Media say lots of things. We need a lot of more time to really find out, is these vaccines are really bad? We don't know yet. Really, we don't know. We have very little information.
Well, that's why we get experts like all of you to repeatedly come on our shows, because you understand it better than us, and I think it works better when people hear it from all of you on what to take seriously and to what extent, and how to How do you interpret it and how do you understand it? Professor Gautam Menon, I want to take the conversation forward about children, and I do that because in India, there is a mixed view, and we've had conversations with task force members from Maharashtra, Karnataka, who repeatedly say that they are seeing a high number of children who are getting infected now, and some of the states have begun to make preparations for third wave with special pediatric wards. Is there a link with this variant, or is it that in general the virus seems to be evolving and becoming a bigger threat for all?
Okay, so let me say very clearly that there is nothing that I have seen that says that children should be especially affected by this virus. Because overall numbers of cases are increasing, they're increasing in every fraction of the population. You will have more elderly, more middle-aged, and more children. But children are not being singled out specially. They're not being specially targeted by this variant. And there's nothing that I have seen that would convince me that that is so far, that would suggest that that is not the case. So we have to distinguish between anecdotal experience of individual physicians as well as what the data say. There's nothing in the data that suggests that children are especially at risk.
Okay, Dr. Rakesh Mishra, would you also agree to that?
Yeah, that is the fact. Biology of virus has not changed that it indicates any preference for any population, any age group. And I mean, when you can connect that 1 year children have been in lockdown and constrained, schools were closed, and suddenly we opened the school and they will not practice that much discipline. I mean, adults are not practicing discipline, were not actually in January, February of mask and all. Children will be playing, they are more active, they will exchange marks, they do all the, so that's why they get more infection. But otherwise, there is no other thing. But having said that, I'm very happy that the states are preparing for the third wave and pediatric provisions in the hospitals for ICUs and oxygen now, because hospitals are generally not so well equipped for smaller age groups, these kinds of units. So that's good thing to have. But that is not because the virus is going to be more aggressive against children. And probably even if children get more infection, they are very strong immunologically. They may not need that much, and risk is less. That's why vaccine is preferred over 45 plus and so on. So we don't really have to worry at this moment in particular in this sense.
I actually wanted to also ask you a question on the extent of the testing in genome specifically genome sequencing that India is doing, and in comparison to what United Kingdom or even US and Germany seem to doing, we seem to be still lagging far behind, Dr. Mishra, even for the Delta variant, which is for us the biggest concern right now.
If we sequence more, we will have more information, more granularity in the data, and we'll be able to make better suggestions, better advice. But I don't think we have missed out much by less sequencing. Please remember that these variants were discovered from the sequences that we deposited. So it's not that we have missed out and somebody else had sequenced it. So, but it's always the case that when new variant starts to emerge, we keep noticing it, but we will not know whether it's going to be a variant of concern or not. Variant of interest is yes, if it gets mutated at some positions which are suspected to change the virus properties. So then we call it a variant of interest. But once something starts to increase its footprint, then automatically it becomes a variant of concern, and we have not missed that so much. So while we should, so actually we are doing okay because we are able to sequence from cities and all. What we are not able to do, or we should be increasing certainly, is the scientifically randomized samples from distant location, all geographical locations, so that if new variant emerges somewhere, we will know it early enough that we can restrict in that place. If we are able to pick that, then we can prevent some, at least incidents of a more spreading virus. If we don't do that, we will be picking only when it comes to hospital or comes to major cities. So that is one thing that we have to see. But otherwise, I think vaccine breakthrough or in the cities, we are sequencing. We will not be able to do 5% at this rate of infection. But if we sequence more, we will be better equipped. But it's not that bad at the moment.
Okay. Dr. Polly Roy, though, can you give us insights on how you go about doing the genome sequencing in United Kingdom. Is there a lot of randomized sampling testing as well that is included beyond the patients who come to the hospitals?
Yes, because in England, they are doing a lot of sequencing and they're very organized it for a long time now, because they have different, not only Sanger Institute, but many different places, but including the National Health Center that they're doing that, Public Health Center. They spend a tremendous amount of money for that. And, India is started much later and they are doing very well, but much later they started than UK started this, not COVID, for all the sequencing they started long time ago. So it was much faster there, but generally they don't sequence that everybody that don't have any disease. They just sequence where they find the hotspot mainly first. So it was much more planned the way they do it. I'm not involved in that at all because I am the researcher in the university. I really am a virologist and molecular virologist. That's what I work on different viruses. I'm not involved in sequence, but sequence, of course, all of us done. Initially, we have to do the genome sequence to understand how the virus works. But for COVID, this is just, they're looking very, very widely and don't have to do randomized but India still have more people and less facilities still compared to England. And England is a small country and less populated. So you just cannot compare the two countries. It's different situation.
Right.
But as far as I can see, they have done well, quite a bit progress. So, we get a lot of information. As long as they're transparent, everybody can get the information also.
Yes, I think it's extremely important in today's day and age that all countries are also very transparent about what they're finding and when they're finding and are able to share it with the rest of the world so that others can also be alerted for, the newer variants or dangers that are coming across. So one more question to you, Professor Roy, first, and then I'll go to Dr. Roy first and then Professor Gautam. Dr. Roy, basis what we know so far about the Delta variant, does our policy, our way of handling or facing COVID change, whether it's at the unlocking stage or how we protect ourselves? A year ago, we were unsure about masks and we said everybody doesn't need to wear a mask, only the medical professionals need to. Then as we found out more and understood more about the virus, we said, we must all mask up. That's our biggest weapon against the virus. We're now talking, and many of us are following the double mask rule. And we are double masking now and keeping larger distances because it travels now faster and easier, longer distances as well. So any such changes that we must be aware of now?
Well, I think that you have this variant because you have done the first wave, the lockdown was very, I think it was first time was good, but after then they ease out very fast. And as far as I know, you had a lot of gatherings and many things, celebrations, everything happened, which is immediately frightened me to see it even. When I learned this happening, I said, my God, they're going to get a lot of viruses. And of course, more you have a big gathering, more virus will transmit one to another because it's aerosol and then people don't wear properly masks. Even they wear masks, they don't want to cover properly. They take off. I've seen it even in England, people doing that. So nobody likes to wear mask, but this is the only choice you have right now. If you want to go out, you have to have the mask because it will not touching and vegetable washing, nothing like that, but it's aerosol. So if you can inhale, it will come if it's too near to each other. If somebody is infected with a high load of virus, they will spread it without knowing. So that's why it is important to be very cautious for a long time. You have to be for a long time to do that. As long as you have somewhere, some state, some rural area virus is circulating, you have a chance to come back and then become a new variant again. So to stop that is the only way you have to go forward if you don't vaccinate everyone yet. So you don't have enough vaccine to vaccinate then you have to follow these rules.
Right.
There's no other way right now.
Right.
Because, this is the only way you take the precaution. I know that people don't like it to wear masks. I don't like it, but I have to. There's no choice. There's no choice to go outside. You have to protect yourself. Even I'm vaccinated completely, but
Yes.
we have to follow.
Well,
The
that's
rule has to
actually
be
an
followed.
extremely important point. Even when you're vaccinated, you must follow these basic rules. Professor Gautam, if it is transmitting via air more, do we still have evidence to suggest we must continue to sanitize everything around us, drown ourselves in sanitizers and all the surfaces as well all the time?
No, we've known that for a while, that this excessive sanitization of surfaces and staircases and so on is not really required. In certain high traffic regions, for example, lifts where people touch many surfaces, you might want to clean that. But there's no reason to be as completely devoted to sanitizing surfaces as we were earlier. This is a disease that is transmitted by a respiratory route through small droplets. We should concentrate much more on ventilation, very important, as well as the wearing of masks. And that's, I think, how we should look at how we should prepare for the next few months as we come out of the
So let's put it in Indian context then. And when we talk about unlocking, and in a couple of weeks, states will again begin to open up their shops and malls, public transport. Is Delta variant a bigger challenge than it was when we unlocked after the first wave?
Yes, it certainly is, because we know it is much more transmissible. And therefore, nothing has changed in the way it transmits. All it just is that more effective at infecting people. So we should be much more careful about how we choose to unlock down. We should be very careful about ventilation. Open last those places that are worst ventilated, for example, closed theaters and so on. But try and open up to things that are more in the outside, more in the open, where you can move some of your activity towards the outside, which is well ventilated.
Dr. Mishra, would you like to comment on this, keeping in mind the high density population that we have? When the second wave hit us, we said, oh, this was sudden, it came out of nowhere, and it was so fast. Now, as the cases seem to drop, a word of caution that, it can spike anytime again.
Absolutely. You just heard Professor Menon said it exactly, that this virus is exactly the same, but it's more infectious in sense for two reasons. Maybe it's binding more efficiently, and most probably the virus production is most in individual, because we are seeing most cases low CT values. So there's more virus released by the person. That's why it's more infectious. So we have to do essentially the same thing, but don't go into closed places like restaurants or malls or cinema halls. They should be opened last when people are vaccinated. And at the same time, we should not spend a longer time in next to another person, whether buying vegetable or buying something. We quick earlier, if it was recommended that 10-15 minutes, now we should not stay more than 5 minutes, finish our job. We have to be more careful. It can be managed. See, if you lock down and the cases come down, that means we know how to handle it. If we can practice lockdown kind of thing in our heart and be more disciplined, we can get the same benefits without the economical disaster that our town brings. So that is something like we know that this virus stays in air in the public toilets for much longer because there is no aeration there. Somebody has used the toilet and removed the mask using the toilet, coughed or sneezed. If you go even in that after 1 hour, you might get infected. So when you go to closed places where others have visited, please keep the mask on. That is very, very important, and don't touch your mask. Certain discipline we have to bring in. The lockdown results show that we can manage this virus. We have the tool of vaccine. If we keep testing and isolating people, reducing the chances of virus to spread, and the rest of the people who practice discipline way, we can operate and go towards normalcy without much damage. If you don't do that, virus is around, and all you know, there may be even more infectious virus coming out, because that's the nature of the virus. This is doing everything for its survival.
Right.
So we should not at all think that positivity has come down, so there is anything has changed. We should take this as advantage, and I will say to go for a kill. Do everything possible to eliminate the viruses. Social distancing, mask, vaccine, testing, and isolating. If we do everything, we can come out of it with much less damage. Otherwise, we'll keep seeing waves and waves.
Right. No, you're absolutely right there. And you know, one extremely important point that you made there is that the virus stays in the air for a long time in closed spaces. And we need to keep that in mind, because often people, if they enter a room in a public place, in a bathroom, in their offices, and they don't see anybody around their own cabin or cubicle or the bathroom, they're going to take their mask off. That's not okay. That's extremely dangerous, and that we need to keep in mind. Big thank you to all three of you for joining me on this conversation and taking the time out and taking all my queries as far as the Delta variant is concerned. Extremely important to understand what we are up against. Only then, armed with information and a mask, can we beat COVID while we wait for our turns and for those around us to get the vaccines. We have no other choice but to follow the basic rules of masking up and maintaining our distance. This virus now spreads faster, easier, stays in the air for longer, travels a longer distance. It's changed from what we knew of it a year ago, and we must keep that in mind. Thank you for joining us.